Our top story here at 5:30, a sobering message for the Kern County Board of Supervisors today. Federal assistance for a range of county programs is going away to the tune of more than $500 million. 17's Robert Price explains.
Kern County government has dealt with budget deficits many times before. For the Board of Supervisors, prioritizing shortfall spending is literally part of the job description. The solutions are limited. Cut programs and services, freeze hiring, seek alternate funding sources. The crisis before the board now will require some of those same choices, but this time it's different. The task at hand is borderline apocalyptic, with federal support for a number of programs disappearing or in danger of disappearing in the wake of the Trump administration's DOGE cuts. The county receives $529 million annually from federal sources, either directly or through state allocations for things like social services, workforce training, and child support services. Also at risk, state funding for safety net programs like Medi-Cal, independent of what Washington does with Medicaid cuts. All of that will weigh heavily on residents of Kern County, where 19% of the population lives in poverty, a figure 1.5 times higher than the statewide average of 12.3%. East Bakersfield has a poverty rate of 44.8%, more than twice as high as the state of Mississippi. Of particular concern on the home front, a shortfall that will hit the Department of Public Health right in the gut. The department is already facing state-mandated cost of living increases for healthcare workers, but then 7 weeks ago, without warning, the Federal Centers for Disease Control rescinded $10.5 million in funding for the county department this fiscal year and next. Public Health Director Bryn Kerrigan laid out some of the painful details at Tuesday morning's Board of Supervisors meeting. Cuts to immunization programs, communicable disease remediation, mobile services, health education, lab equipment for testing, and more.
We rescinded multiple job offers to prospective employees. We issued an immediate internal hiring freeze and overtime freeze, as well as a spending and travel restriction within our department. However, given the compounding pressures of increased costs and shrinking resources, we are no longer able to sustain status quo operations in our existing workforce without additional support.
Lito Murillo of the Department of Human Services said CalWorks, CalFresh, and Medi-Cal are facing new realities.
They're looking at reducing Medicaid by $880 billion. That's about a 12% reduction. I said that there was about 400,000 people or so receiving here Medi-Cal in Kern County. That would be about 50,000 people potentially losing out.
Michael Turnipseed of the Kern County Taxpayers Association said the federal government's withdrawal from the long-running practice of helping fund local services will require reorganization like nothing local governments have ever experienced.
We've seen recessions, we've seen this, we've seen that, but I really think you're seeing fundamental change. The fork of the road is here.
How will these changes affect the lives of ordinary residents? The full details are yet to come, but rest assured, it will be significant. In Bakersfield, Robert Price, 17 News.
Well, a measure of good news tonight. The